I am Dr. Pranav Shah. I am head of the Orthopedic Trauma and Hip Replacement Department at Marengo CIMS Hospital. My colleague is Dr. Mayank. He is a senior anesthetist and who helps us with all our cases. We have successfully done a 3D printed cage implantation for a hip replacement patient whose hip was unstable because of complications of surgery done in Nigeria. In a matter of 1 month with 2 surgeries, we have been able to remove her socket which was pressing on the main artery, and we have been able to implant a 3D printed cage to cover up for the bone defect, and after that with hip replacement the patient has been able to stand, walk and move around without pain. We are happy that we are discharging her today after almost a month of hospitalization in a painless and happy condition.
Lọ́la mo máa lọ sókè lókè sí i lọ́la ilé ìjẹ́bí ọlọ́run lọ́la bísí láì rán ọmọ àyàmí aráwọ̀ ìlọ ayé mọ ayé kí á fi jí ìyá kaná àgbà ìyá kaná sáyé ìdí náà sọ́tà ní sẹ́yìn sọ́tà ní ẹ̀sìn ẹlẹ́kùtà lè yí lẹ́yìn ìmọ̀ tó yà lé wọ́n dàgbà ìyàn bísí láì rán ọmọ ìlọ yìí táwa kalẹ̀ tún aláìláì láwùláwà lápò àtàlí lábẹ́ àlílẹ̀ àti bísí láì táwa kalẹ̀ tún aláìláì láwùláwà lápò àtàlí lábẹ́ àlílẹ̀ àti.
What are the benefits of a 3D printer?
The benefits of the 3D printed cage is that the void that is being created cannot be filled by any substitute other than the 3D printed cage. Previously we had the routine cages where the fitting was not perfect and they would loosen out over a period of 3 to 4 years. But the 3D printed cage is customized to the patient's defect, and so it holds very well, it is very stable, and it has a place for bone ingrowth so that the grip on the bone increases over a period of time. Yes, any patient who has a bone defect after a failed hip replacement will benefit with this technology. The lady that we operated was 56 years old, 120 kg. This can be replicated for any patient 4 feet height to 6 feet, 7 feet height, because it is customized to the patient's bone. So the size of the cage will come according to the defect of the patient's bone. It is based on the CT scan of that patient. That is why it can be used in any size, any shape of patient. Operative, the patient has to take care of walking with a walker or stick for 3 months. In that time, the bone ingrowth in the cage has already started, the stability improves, and then we can allow the patient to walk like us.
So follow-up action, he has to come here or we can do there itself, Nigeria?
So for a patient who is living in Nigeria, I would prefer to do a video consultation of that patient rather than call her here, get the x-rays from there and get them emailed to us, so that the patient doesn't have to spend so much money to come for follow-up. So for a patient in India, it is always better if they come for follow-up.
So what the cost is there, and is it being covered by the government?
The government may not cover the cost. This patient has borne the cost, and most of the times the patients bear the cost. Even the mediclaim companies are reluctant to bear the cost, because anything which comes with new technology is not a part of their existing memorandum of understanding, MOU. So this cost usually is borne by the patient, but it's a very good value for money. For a 2 to 2.5 lakhs.
Any subsidy provided?
So in this patient, yes, we have done some subsidy from our side because we wanted to do it for her. But otherwise, it's not, the hospitalization is not so long. If the patient is living in Ahmedabad, the patient comes in for the surgery and may go back in 5 to 7 days. The advantage of this technology is that it has given us a solution when nothing existed before. If there is a patient with this kind of void previously, we would have to, wait for 6 months before we do the surgery. We put bone graft, we put cage, we put the mesh, and we wait for those things to consolidate. And then we do the second stage surgery, and that also we know is not going to last for more than 4 to 5 years. But with this technology in now, we know that this patient can do as good as any other hip replacement patient.
How much time did it take to operate?
The surgery takes around 3 to 4 hours because we are going in from an area which has already been operated 2, 3 or 4 times. But it takes 3 to 4 hours.
So the machinery has been from India only, or
yes, it is totally made in India product.
Okay. Thank you.